Go Island is brought to you by German Auto Import Network.
Today we are visiting the Oceanside Health Centre. On today's show, amazing woodwork from a retired steel worker, reinventing the flashlight and tracking bison near Prince Albert. That and more in the next 30 minutes. The Oceanside Health Centre in Parksville has a renewed focus on person-centered care. What they've done here is brought health practitioners from the community and combined everybody together as one team under one roof for, as we mentioned, person-centered care. We're going to have a look at that and how it's done on this edition of Go Island. But first, Kelly Robinson introduces us to a man who works with raw wood. Ted is open every day, all day, and he always welcomes visitors. You're watching Go Island on Shaw TV Channel 4. Dr. Bob Burns is the Executive Medical Director here at the Oceanside Health Centre, focusing in on primary care. And there's some experimenting happening here with increasing the potential that primary care has to aid patients in the community.
And not just this community, but all communities. Healthcare is under strain,
right,
because of the costs. And in order for us to get a handle on those, we need to get a much better way of dealing with primary care to keep people out of hospitals, which is the expensive part. So this particular site, the Oceanside Health Centre, has an integrated healthcare team approach to providing that primary care. So unlike when you go and see your family doctor one-on-one,
which is the core or traditional of what we know to be primary care.
Yes, it's been a great way of getting primary care, and people love their doctors, we know that.
Yeah.
And the care they get when they are attached to their doctors is helpful in terms of helping them stay out of acute care.
Right.
But we need to be better at it because we simply can't afford the acute care we're spending right now.
Mm-hmm.
So what this model involves is putting together a team, and in places where that's been done, we get the predicted effects of reducing emergency department care, reducing admissions, those kinds of things.
Who's on the team?
Good question. The team consists of primary care providers, in this case both a family physician and a primary care nurse practitioner, accompanied by somebody to do the scheduling, somebody to do just clinical administrative things, but then perhaps more importantly, a nurse who no longer does actual nursing but instead coordinates. And her role, his role, is to manage the panel of patients who are seen by this team.
Okay. It's not open yet. When
No.
I read the material before coming to the site today, how can I become a patient? It opens September
The 30th.
30th.
Is when the primary healthcare side begins in this operation.
Okay, and how do you become a patient? What is the intake process? Because that's what people are going to want to know.
What we haven't actually worked out the details of the intake process, but what our intention is to pick up those patients in this area who are at present unattached, in other words, who don't have a family physician.
And there's a lot of those.
And we know there are at least 1,000, and we know there are a lot of people in this area who get their care outside this area. So we expect that there will be a fair number involved in that. The second phase will be those who have family physicians now, but not locally. Because this is a place that people retire to, many of them come from mainland, and they keep their doctor over there because it's difficult to get a doctor over here. So we want them to have the next shot. And then when we're down the road, and we start with one team, but we will be going to a second team when the demand indicates the need for that.
I get the sense that that demand will present itself pretty quickly.
It may do,
Yes.
but what we're also doing with this center is trying to provide a similar sort of support, a team kind of base, to doctors in the community as well.
Okay.
So that the patients in the community experience the same level of care there with the same focus on keeping them healthy as our team here will be providing.
Dr. Burns, thank you.
Thank
I
you
know
very
we've
much.
just touched the surface. You can get more information on the Vancouver Island Health Authority's website. It's the new Oceanside Health Centre opening in phases, and you want to get your dates and information correct before you just show up. We're going to look at the urgent care section that doesn't open until September the 16th later on this edition of Go Island. But first, we're heading down to Victoria. There is a 15-year-old girl who has reinvented the flashlight. Still to come today on Go, smashing glass into art and a trip to the Sturgeon River Ranch near Prince Albert. That and more still to come today on Go. You are watching Go Island on Shaw TV Channel 4, and today we're getting somewhat of a customized tour of the brand new Oceanside Health Centre. We're upstairs now. Sheila Cruikshank is the Director of Operations here at the Oceanside Health Centre. It's all about integration where we are right now. What happens in this space?
In this space, we have 215 staff who deliver service to the community. So they go to individuals' homes. They also deliver service in the doctor's offices, and they do group work that is focused on health promotion. So it might be falls prevention or heart health or diabetes education, but mainly our staff here do home-based service. We also do some service here in the center, counseling, some of the other kinds of interviewing, and some long-term therapy with mental health and substance use.
What do you think is passed on to the patient by having all of these people that work in different fields, but still in the field of health and care for people in the community, working together in the same space, side by side? There's a collaboration and a learning that couldn't happen before.
Exactly. You know, we're already finding that the staff, because we've moved from having 6 programs into actually working together now in one whole space, they're learning from each other, they're understanding roles better, they understand that, you know, one person could actually look after somebody and be the focus for that client rather than 4 or 5 people doing the same type of work. So we really streamlined the work. The staff are learning about each other, and I think the patient is really benefiting from that.
We were having some conversations off camera before this interview talking about how often a patient has to go and explain their story several different times to different professionals. All the professionals are here in one space, getting the patient information onto one page, quite literally.
Yeah, we have each person that is actually receiving service now at the Oceanside Health Centre has their own electronic health record. So this is a big step for this community, because rather than having 5 or 6 or 7 different files or different records, you actually have one. But it's also linked to our hospitals. So if somebody needed help in a hospital setting like NRGH Emerge, they'd be able to pull up this record, know what's going on, and people don't have to repeat their story. So it's very helpful for them. This
has been about 13 years in the making.
Yes.
A concept that started 13 years ago. How's it been received already? We're going to cover what the different phases are of opening. It's not entirely operational yet, but I get the sense that success is already happening here.
Well, and you know, the community has had mixed emotions about the health center. I think there still is a feeling that a hospital might be of benefit to the community. And there is 48,000 people that live here and 500,000 tourists in the summer. But I think what they are finding through the last year, that they are becoming engaged in the whole move to a different kind of model, where in fact we can create a sustainable system focused on their health and their health goals. Right. Rather than on them being ill, it's really about keeping them healthy and keeping them in their home and their home environment. So this health center really focuses on that. So do the clinicians, keeping people healthy. What is their goal? What do they want to achieve with their health? And how do we get them there?
Excellent. Yeah. Thank you, Sheila. Okay. We're going to discover more about what happens here at the Oceanside Health Centre later on this edition of Go Island. In the meantime, Marianne LaPlante is smashing some glass. You're watching Go Island on Shaw TV Channel 4. Today we are at the Oceanside Health Centre in Parksville, showing you quite literally how telehealth works. Rhonda Brown is a telehealth coordinator at the Oceanside Health Centre. What is it that we're doing here, Rhonda?
What we're doing is telehealth enables providers and clients to connect via distance. So we have a client base in the Parksville Qualicum community that need to travel without telehealth to Victoria or Vancouver to visit specialists for specialty care. With this technology, we enable them to connect via distance, so they stay within their community, they stay with their family members and their loved ones, they come here, the provider connects, and they have their face-to-face consultation.
That's very cool, and it's all taking place in the health center here. What does it mean for the patient to be able to do it all here in this one center? Not just having to drive to see their specialist, but be able to see their primary care doctor and then come and do something like this.
So when they're here, say for example we have a cardiology client that is here and they're visiting with their cardiologist via distance. The nurse is here with them, they've connected their digital stethoscope, they're going through all of their checkup that they need. Then the doctor prescribes the prescription, which is faxed here. They can fill it in here. The nurse is also here that after the consultation they can follow up the client and go over what the doctor's notes are or any questions that the client has. It's all here at this site.
That's fabulous. I don't think I knew this existed, and I guess a lot of people out there don't. Until you have to use a service like this, you probably don't know that it's available to you. We'll be back with more on this edition of Go Island from the Oceanside Health Centre. You're watching Go Island on Shaw TV Channel 4, and today we are exploring the new Oceanside Health Centre in Parksville. One of the great things about having all of the facilities under one roof is that, you know how when you go to the doctor and you need to take some blood tests or some other kind of tests, or you need some medical images like ultrasounds or x-rays or some kinds of scans, well, they give you white pieces of paper, you get in your car and you head off somewhere else and try to fit it into your schedule. Here at Oceanside Health Centre, Life Labs is right on site, as well as the medical imaging. You can do it all under one roof. We're going to throw things over now to Big Summer. We are tracking bison. That does bring us to the end of this edition of Go Island. Quickly, before we wrap up for today, though, just another note on the urgent care here at the Oceanside Health Centre. It opens on September the 16th. And just to clarify what urgent care comprises of, it's assessment and treatment of conditions that need same-day care. Things like asthma, simple fractures, lacerations, acute pain, shortness of breath, or some allergic reactions. Those are some of the conditions that you might be coming here to the urgent care center for, beginning September 16th. Thanks for watching this edition of Go Island. We'll see you next time.
Go Island is brought to you by German Auto Import Network. Clothing supplied by Catwalk Fashions. Kait's Hair and Aesthetics provided by Maffeo Salon.